According to the CDC, heart disease is the leading cause of death for both men and women, with one person dying every 33 seconds here in the U.S.
And February is American Heart Month, and our next guest wants to remind all of you out there of the signs and ways we can lower the risk from this deadly disease. Joining us live is Dr. Ali Sovari. He is the Medical Director of Electrophysiology at Dignity Health St. John's Regional Medical Center. Welcome. Good to see you.
Hi, thanks for having me.
Super important topic, the #1 killer of men and women, and not a lot of people are talking about this. What are the signs, and I know that's a big question, but what are the signs of heart disease?
Sure, a very good question. Heart is primarily a little muscle structure that its main job is pumping blood to the rest of the organs in the body. It has 4 chambers and valves in between, and it has a little area, its own pacemaker that creates the pulse, travels through the heart, and make that pump happen. Now, if this pump gets weak, that presents itself usually as a shortness of breath. On the other hand, if this pulse formation or traveling is too slow, it presents itself as dizziness or lightheadedness. If it's too fast and irregular, it can present itself as palpitation. Finally, heart has its own arteries that brings oxygen and nutrition to its own muscle. If there's blockage there, it usually presents itself as a chest discomfort. Shortness of breath, dizziness, lightheadedness, palpitation, and chest discomfort are main symptoms of heart disease.
Okay.
Do the signs differ between men and women?
There are many similarities between men and women in terms of the sign and symptom of the heart diseases. Women can have also a lot of heart diseases that men have. There are also some differences. For example, during the heart attack, it's often men experience that as a chest pain or discomfort, and women can experience that as a vague feeling in the chest, not necessarily a pain, or it can be felt in the jaw or arms rather than the chest in women. The triggering effect and factor can be different between men and women as well. In men, often the heart attack is triggered by physical activity and distress. In women, it can be emotional distress.
Okay.
Interesting. Okay, and then the treatment options now. There must be so many out there.
There are so many new developments in treating cardiovascular diseases, all very exciting. If I want to summarize in the last several years or decade, what was the biggest step in cardiovascular treatment? The biggest, in my opinion, has been minimally invasive procedures. A lot of treatment options that used to be available only through big open heart surgeries, now they are available through an IV line from the leg or arm with the patient going home same day. This includes changing the heart valves or fixing the blockage in the arteries of the heart or fixing these rapid irregular heartbeats or catheter ablation. And nowadays, even implanting new devices in the heart, such as pacemaker, that can be done again minimally invasive and through the IV lines from the legs or arm.
Wow, fascinating.
No, it is.
Can you explain what a dual chamber is and how that helps?
Dual chamber pacemaker is a device that when the heart pulse is not adequate and enough, it comes in and gives the heart pulse, and it allows the heart to beat, to continue to beat. Traditionally, the pacemaker was implanted by making a cut in the chest and putting it under the skin in the chest, involving an operation. And nowadays, we have the leadless pacemaker. We have this very small piece of device that has all the circuitry and the battery and everything that the pacemaker has. And when we implant this through an IV line inside the heart, and after the procedure, no one can tell even that patient has a pacemaker while this is sitting in the heart and it's doing its job. And we had this in the last few years through a single chamber, minimally providing the minimum adequate pacing for the heart. But now we have a dual chamber leadless pacemaker. There are 2 of them that can, one in the upper chamber, one in the lower chamber. They talk to each other all the time, and they can provide the physiologic pacing that the heart needs all through minimally invasive procedure.
Man, amazing.
And as we wrap this up, what can we do, men and women, to lower our risk?
A lot of important points there. Probably we all have heard about diet and exercise. I would like to take attention of everyone to also other important things. And one of the important things aligned with what we just discussed is early detection of the diseases. If anyone has any of those symptoms that we just mentioned that can be heart disease, it's very important to pay attention to go and diagnose it. We have a lot better options for treating cardiovascular diseases if the detection is early.
Thank you so much.
Absolutely.
Incredible information.
Great information.
Yeah, we appreciate it.
Absolutely, my pleasure.
Everybody get to the doctor.
All right, for more information on Dignity Health St. John's Regional Medical Center, you visit dignityhealth.org. You can also follow the center on Instagram. By the way, my grandfather, when he died, he was on his 3rd pacemaker.
Wow.
He outlived 2 of them.
And I'm sure it didn't look like that.
No.